Hello and welcome to this second video of the Botox Flawless 360-degree Mastery 1.0. In the previous videos, we have been discussing about how consultation skills are important and what all should be there. So this video is again in continuation with that only. So let's get started. So far we have understood the importance of initial consultation and managing treatment expectations. And these are the two things which are going to help you after the procedure has been done. And if you give ample time to this, it is going to help you in the long run. So initially you can keep a checklist. You might have to go back and look at it again and again, but then gradually with practice and with time, these things will, become a part of your, natural way of communication or consultation with your clients. So the first thing first, you have to determine which area is the treatment being sought for. So face has various facial aesthetic units. It could be forehead, periorbital, temple, cheeks, upper cheek, middle cheek, lower cheek, and nasal area, perioral area, chin, jawline, etc. So which aesthetic zone the treatment is being sought for, you have to identify that aesthetic zone. Second, check the understanding of the treatments available. Now, some people, they are very confused. They feel that Botox can be done on cheek also, Botox can be done on chin also, although they can be done, but their understanding, Botox is not a filler. They feel that if you're injecting Botox, it's something like a filler. You are putting something. So you have to make them understand the various treatments available and the difference between those treatments and the impact they're doing. Botox and fillers work very differently. Their longevity of the results is different. Their mode of action is different, and they solve different purposes. And sometimes they feel that Botox can do everything or fillers can do everything, which is not true. So giving them clarity and understanding them, making them understand the treatments which are available for which indication, it is very important. Second, the third thing is educate the patient on the changes in their skin, bone, muscle anatomy. Now, this is what, most individuals do not know when they come for consultation. It is the practitioner who knows that all the 5 layers of the face, like bone, deep fat, muscle, superficial fat, and the skin, all these layers are aging differently at different pace in different, regions. So, but the changes are getting reflected onto the surface of the face or onto the skin of the face. Now, which changes are contributing to which changes is, a thing of your expertise that you have to identify and make them understand that what anatomical changes are bringing about what clinical indications on the face. Inform the patient on the procedures available. What all can be done with what, like fine lines and wrinkles. They can be treated with Botox and collagen induction. Sagging and lifting can be a more of a domain with which is dealt with fillers and threads. So different procedures cater to different indications. So this you have to make them understand. And create a treatment plan which can deliver the best results. For example, if someone is coming to you for under eye hollowness, the right way to go about it is treating the lateral and the lower cheek, the anterior and medial cheek first, followed by the treatment of the hollowness, because it is the lateral cheek which contributes to the lifting of the lower eyelid, and the anteromedial cheek which contributes to the reduction in the length of the lower eyelid. So once these are done, then only you can directly approach the hollowness. If you just approach the hollowness without addressing the cheek, the lateral and the anteromedial cheek, you are bound to give unnatural results. So this has to be sometimes explained in detail. The anatomy has to be explained in detail. So you have to create a treatment plan which will give the best results, and spend sufficient time with the patient to understand their needs. And it is a known fact that the minimum time required for an aesthetic consultation is anywhere between 1 to 1.5 hours. And it has been, documented by clinicians across the world. And so the 4 major aspects which can be covered or which need to be, catered to in the initial consultation are the perceptions, expectations, worried about the cost, complications, and how the results will look are the key barriers to the treatments. And these are the barriers which your consultation will help them overcome. So there might be various queries related to different stages of treatment. So initial studies will be, they might be concerned about, about the events happening before the treatment, events happening during the treatment, and events happening after the treatment. So before the treatment, they might be nurturing the fear of complications. The fear of injections like trypanophobia is very common. And this becomes obvious in aesthetic procedures, because otherwise in other places, wherever we're injecting, the person are, ailing, they're suffering, they're, facing some ailments. So they're not really bothered about the injection. But in case of aesthetic clients, we have the healthy clients and who are overthinking about themselves. So this fear of injections or trypanophobia is very common. And I have done a separate YouTube video exclusively which explains how to help your patients overcome this fear of injections. So I would encourage you to watch that also. It will give you various insights into the management of hyperactive clients, especially who are worried about the fear of injections. Then they might be bothered about the invasiveness of the procedures. They might be concerned about the general safety of the procedures, because nowadays social media has given us so much of information, and the negative press has filled up our mind space with so much of information that it's the bad things which come out first rather than the good ones. So people are watching everything every day, and that is what they might be concerned about, the invasiveness and the general safety. Then there might be apprehensions during the procedure, like how painful it is, whether the results are worth it or not. So the magnitude of the results might not sometimes be congruent with the amount that you have been charging. So you have to make them understand that the amount that is being charged, or the price is about the value that it gives to your face and your life, rather than the magnitude of the results. Because sometimes, after the procedure, people feel that there's such little difference and you've charged me so much. So this has to be made clear that it is the value that it's giving to your appearance and not the magnitude. And the outcome was not perfect. What they think would have been the result is not what it exactly it is. So this can be dealt with by, prior assessment of their expectations. Then they might come with the complaints of that last treatment was not effective. So you have to look into that, like what was the procedure, how was it done, where was it done, and why it was not effective. History of previous injectable procedures and their outcomes is equally important in the current treatment. So the results might look unnatural. Just as I explained, for under eye hollowness, if you straight away start filling the under eye, it is bound to give unnatural results. Natural results will be only if you treat the lateral and the anteromedial cheek first, and then later on deal with the under eye hollowness. That is the way to give about the natural results in the paraorbital area for the under eye hollowness. So every indication in has a specific way in which it has to be dealt with to give natural results. Otherwise, it gives unnatural results. And sometimes they might feel that recovery has taken too long. People feel that injectable procedures, they are instant. You can you get the procedure done and walk away, and you get over with it. But sometimes this is not the case. Young individuals will recover fast, and the senior age group individuals will take some time to recover out of that procedures. There might be some pain, slight tenderness, etc. In the senior age groups, and it might take some time. So this has to be again explained. Now, the other factors which might bother them are that first thing, when you tell them that Botox you have to get every 3 to 4 months done, fillers, the life is 1.5 years to 18 months, and it needs slight touch-ups might be required. So this sometimes comes as a discouragement. They take it as a discouragement for the treatment, because the moment they find out that this will have to become a habit, or this will have to be taken again and again, they get demotivated for the treatment, because this is not what they came expecting for. They thought that they will get them they'll get the treatment done and they'll be solved of the problem. They are not very attuned to the fact that these things will need repetitive sessions. So this is something that has to be made clear. Now, another apprehension, it is very common, and it's very common in doctors also. I know a lot of practitioners, my colleagues and peers who are not into injectables, they are, belonging to different medical fraternities, but they are also of the opinion that they do not want to get any foreign matter injected into the body. So that is something, scientifically or maybe clinically or aesthetically, we might not be much concerned about this fact, because obviously we are doctors, we are, used to injecting toxins and used to injecting various stuff, but this fear of apprehension of getting some foreign matter injected in the face comes as a major challenge for most of the individuals. And this has to be explained in a very strategically and smart way. And then sometimes they will come with some their decisions of their own that, doctor, I need anti-aging, but I do not want Botox or wrinkle injectors. You can, if there's something else, if there's some cream or ointment or some other treatment, I'm ready for that. So again, they come with mind blocks, and it is up to you how you handle them. It has to be handled very tactfully. So if they do not, straight away agree for it, then you might need to create a strategy or something. There are some strategies that you can, do, which I will be definitely discussing in detail in the later videos. So consider addressing these concerns during the initial consultation and during the treatment process. Now, the core topics for the initial consultation can be divided into the medical history, assessment, and making them aware of the potential complications. Now, medical history not only includes the history of the previous illnesses or ailments or any medication that they're taking, but it also includes the psychological and the emotional assessment. This comes as a very important and main aspect of the aesthetic treatments. Psychodermatology or psychoaesthetic dermatology comes as it forms the, it's not the tip of the iceberg, but it is something which lies beneath the tip of the iceberg. The psychological and the emotional assessment, it is very important because you are dealing with faces, and sometimes the outcomes, when they are not acceptable, it can throw the person off balance emotionally or psychologically, because people are seeking treatments because they are bothered and concerned about something in their appearance. And if we are not able to help them deal with that apprehension, and we might end up adding up to it. So this might just get them off balance. I have seen two cases in my practice wherein the person completely went off balance, although the results were amazing, but they were not able to appreciate it the way they should have. And they went completely, haywired over the results and created complete havoc over it. But if you see the befores and afters, there was nothing as better. I mean, nothing better could have been done in those cases. But then again, perception is very important, and the healthy sense of perception comes from a sound psychological and emotional state, which needs to be assessed. Now, the other assessment that you have to do is you have to conduct the whole face assessment, even if they're coming with a concern or a focus on a particular area. But then you need to assess the face in totality and explain it in totality, which will help them have a better understanding of, the procedures and the subsequent procedures, of course. There are a few apps also, but I don't know whether it's functional as of now, because till last year it was functional. But now this My Beauty Plan facial app does not work in India, in our part of the continent. It is still in working condition in US and Europe. So another thing that comes very important is making them aware of the potential complications. Now, this has to be done very smartly, because you do not want to, your intention is to make them aware about the treatment. You do not want them to get discouraged from taking the treatment. So this has to be, you need to create a very fine balance between informing and scaring, So there's a very thin line difference, and it will definitely, sink into your consultation pattern with time. So you have to discuss the potential risk and benefits of the treatment so that they can make an informed decision. The decision has to be their decision, and managing patient expectations should an adverse reaction occur. You need to tell them that also. So with this, we come to the end of this video, and wherein I'm talking about the consultation skills and the aesthetic consultation, various aspects of it. And I hope it would give you great insights into going about doing your consultations. So in the next video, we will be talking about more on the anatomy of the upper face. And so till then, take care and stay tuned.